Hi, my name is Shelby, and we are Veiser. Over 3 million people a year experience uncomfortable and potentially dangerous varicose veins in their lower extremities. Due to this large number of cases, the market for corrective procedures are expected to inflate to $475 million by 2024. The most popular forms of treatment for varicose veins are scleroscopy and radiofrequency ablation. Radiofrequency ablation is one of the most expensive forms of closure for varicose veins, as it requires a highly expensive piece of equipment used to power the ablation that initially costs the physicians between $20,000 to $30,000 to obtain. The procedure can cost between $1,500 and $3,000 out of pocket for the patient, and sometimes recurs, which entails another costly procedure. Scleroscopy is another form of vein closure that requires a chemical or foam insertion depending on the size of the affected vein. The physician will insert a needle into the vein and disperse a chemical or foam to burn the venous wall and close the vein. This form of treatment is much more cost-effective than radiofrequency ablation. However, it does pose different risks. The use of liquid chemical in a liquid environment is difficult to control, and the chemical may be carried through the bloodstream and damage other non-affected areas of the patient's venous system. It isn't always effective due to this lack of control. Other treatment techniques can cause blood clots if used incorrectly, meaning that only highly trained physicians can perform this type of procedure. Our goal is to provide a simple, cost-effective, and easy-to-use device to provide treatment. Our novel and innovative device is a specialized catheter with a unique tip that allows the physician to control the shape of the varicose vein by deforming the vein to a flat ellipse to allow maximum surface area and minimize the use of chemical. This is accomplished by compressing 2 wires into the catheter sheath, which is then inserted into the vessel. When unsheathed, these wires expand, stretching the vein. This method not only helps control vein spasms, but will drastically reduce the risk of dangerous blood clots in patients. Our device not only decreases the risk to the patient's well-being, but with no need for an external battery pack or other devices, it is much more cost-effective for all parties involved. With this device, we can help decrease the amount of equipment required, which allows the device to be used in lower-income countries and also poses less risk to the environment. The design of the device allows physicians to use sclerosant of their choice without being limited to a specific substance, giving the physician flexibility to treat each individual patient as they see best. Ablation catheter devices produced by our competitors are typically sold between $800 and $1,200, with an estimated production cost of our device at only $40. We have added flexibility to the market at a competitive price, along with a larger profit margin. Thank you.